Hi, I'm Rachel Pope, physical therapist and certified yoga teacher with runyogatherapy.com. Today we're talking about Kinesiology Taping to help support the belly and decrease pain. I am 39 weeks along today. You can certainly do this taping earlier in your pregnancy. Sometimes even if you don't have a big bump quite yet, in the second trimester, you're still feeling the heaviness of the belly. And so this technique will help with that as well. So for this one, what we're going to do is we're going to sort of support the front of the belly. So sometimes women feel like there's so much pressure here at the front, and it's like, oh my gosh, it feels like my belly's gonna split apart. So this technique will use 2 pieces of Kinesio or rock tape. And what you're going to do is you're going to tape sort of from the lower pelvis up this way. Okay, so measuring the amount of tape that you need. So I sort of approximate the length on my body, and then I kind of bring it back a little bit because we're going to be stretching the tape, and so that will increase the length there. So I'm going to actually cut 2 strips. So I've got one here. I'm just going to measure and cut another piece of tape about the same length. And then, as always, rounding the ends to help prevent it from peeling up. So that's one side, and then I'm going to do the other. Okay, and then to put it on the body, what we're going to do is we're going to start down low and pull that tape right up. So it's sort of mimicking the rectus abdominus, which gets, the linea alba gets stretched when we're pregnant. So that soft tissue in the middle is sort of pulling apart, which it needs to accommodate the size of baby. So with your tape, what you're going to do is you're going to just take and tear one end. Okay, so tear the paper. You're not going to touch the sticky. If you can, avoid it with your fingers. Okay, so I'm just holding on onto the tape as best I can. And then what I'm going to do here is I'm going to put the piece of tape kind of down low onto the abdomen, kind of near the pelvis. And you may need to play around with how far down you want that to go, according to how much support you need. So I'm going to heat activate that. That's what I'm doing down here. I'm just sort of rubbing that tape to get it to stick. Okay, so no stretch to start. You want to just start it off with no tension. And then you're going to peel the tape almost to the end, and you're going to give it some stretch. Okay, so I'm going to pull it up this way, up and over the belly. Okay, so can you see that there? So I'm giving that some stretch, pulling it up kind of to the side of the belly button. I'm going to heat activate that, give it some tension, give it a little bit of rubbing. And again, the end of the tape, no tension. Okay, so I peel it off. You see you have a little bit of tape left, and then I'm just going to lie that down flat. You might want to do a longer piece that comes all the way up to under the bust line. That might give you a little bit more support. Okay, so I mean, some of this is trial and error to see really what feels most comfortable and what feels best to you. We're going to repeat the same thing on the other side. Okay, so a little bit of placing that, and that can be a little bit tricky with this big of a belly, but placing that down, heat activate the bottom, no tension, peel the paper, you're going to give it some tension, so pulling that sort of up and over the belly. Okay, and then that last little bit, no tension. Okay, so here you have some support here for the 2 sides of the belly, and you can start them more close together and kind of come up this way so that you're sort of surrounding the belly a little bit more. This might be enough. And like I said, I mean, these are sort of suggestions, and you can sort of play around with what feels best for you. Feel free to check out my other videos if you're looking for other taping techniques for different discomforts or pains that you might be feeling.